Good afternoon, good morning, or good evening, everyone, and welcome to this session. First, I'd thank the organizers of this Congress for scheduling this particular panel session. In this session, our panel is going to discuss the impact of survivors and family members to improve sepsis awareness and advocacy. In our panel, I think we're missing one person at the moment, but we have a good mix of survivors, those who lost family, in this case children, to sepsis, and one of our panel members whose contacts with sepsis victims and family members have made her a fervent advocate for sepsis awareness and action. Now, a few introductions. I'll start with myself. Michael Clarke. I'm a chartered accountant, retired after a long international career with PricewaterhouseCoopers, and a survivor of a septic shock 7 years ago. Together with a small group of survivors and supporters in Belgium, I'm kept busy at the moment helping to set up a Belgian sepsis advocacy and patient support group, Sepsibel. That's me. May I now ask each of you in the panel to briefly introduce yourself and add or underline anything that you think might not be apparent from the bio, which is already on the website. I'm going to start by asking first Ciarán, who's on the line up on the screen. Ciarán, quick introduction.
Hi, Michael. Thank you for doing this. Thank you for Global Sepsis Alliance, and thank you for all our fellow sufferers who are on here. My name is Ciarán Staunton. April the 1st, 2012 was a nightmare. We got a message at 6:35 our son was dead from sepsis. We had never heard from sepsis. We had never heard about it. No one mentioned it in the hospital. Then we found out that 250,000 Americans a year were dying from sepsis. We went to CDC. They had nothing on their website under the letter S for sepsis. We knocked on a lot of doors, and there was no template for setting up an organization as we did. And we have come a long way. In New York regulations, Rory's regulations, we have saved 16,000 lives in 4 years. We have spoken in Ireland, we've spoken in Germany, we've spoken at the WHO, and all of us who are in this club shouldn't be in it. Although we're here, we have been dealt a nasty hand in life. Thank you.
Thank you, Ciarán. Next one I can see on my screen is Mary Steele.
Hi, sorry, it's 2 a.m. here, so it might be a little bit croaky. Thank you first for the opportunity to present today. My son Preston died 20 years ago, August, at 2.5 years old, and his death was at the time attributed to complications with pneumonia. A Pseudomonas bacterium overwhelmed him. But leading up to his death, I presented to the emergency department 2 times and was sent home, and then presented the 3rd time after my son's lungs collapsed and he began coughing blood. And regardless of my pleas and concern, it was only then that it was taken seriously and the severity of his illness was recognized. He was taken straight up to the pediatric intensive care unit and placed on life support. Sepsis was never used as a word. It was an overwhelming infection. A few short hours, he went into cardiac arrest twice and couldn't be resuscitated the 2nd time. The word sepsis was not communicated, and my advocacy didn't begin with sepsis. It began to improve ventilation techniques for critically ill children. So I and friends of mine advocated for change and supporting research that raised over $500,000 Australian for training and equipment that translated into new ventilation techniques, significantly lowering the mortality and morbidity of children requiring ventilation techniques. And these techniques are used around the world today. It wasn't until 2013 that I had come to find out that my son died of sepsis and that his death was likely preventable. I became connected to other bereaved families who'd lost their children to sepsis through clinicians that I worked with on improved ventilation who wanted to understand how healthy children could die of sepsis. And it was at that point I became active in sepsis awareness and advocating for change in diagnosis and treatment. If I think if I hadn't already been working to raise awareness about illness and critical illness in children, I may not even know to this day that he died of sepsis. But since 2017, I've been involved in strategic sepsis program committees, awareness raising, lobbying for government funding and priority to be given to improve diagnosis and treatment of sepsis.
Thank you, Mary. Next up, I see on my list seems to be Melissa. Melissa.
Hi, Michael. Thank you so much. And thank you again for the opportunity to be here today. My story, again, very similar to that of Ciarán and Mary's. My son, William, died of sepsis in December 2014. Again, echoed, we never heard the word sepsis. The word sepsis was never used. And it was only when we received his death certificate that we knew he'd died of it. Unfortunately, William had a case of protracted pneumonia, which was undiagnosed. We had visited the GP, the doctors, multiple occasions, and in the 36 hours before he died, we went to 2 emergency doctors and the out of hours, and we were sent home, and William died at home. So I didn't set up the UK Sepsis Trust, but joined it in its very, very early days. Some of you will know of Dr. Ron Daniels, who is the chief exec of the trust. I probably don't need to introduce him. But we advocate for better awareness of sepsis, diagnosis of sepsis, recognition of sepsis, and we do an awful lot in the UK for the education and clinical side of ensuring that healthcare professionals understand sepsis, treat it, recognise it, but also use the word. I think that's being kind of mentioned here today. Actually, we need to start using the word. So I share William's story in the hope for advocacy for awareness and better recognition.
Thank you, Melissa. I see next on my screen, Ken Rothfield.
Thank you very much, Michael, and thank you everyone for joining this session. My name is Ken Rothfield. I'm a physician. I'm an anesthesiologist by training, and I practiced as an attending anesthesiologist for 21 years before transitioning to being a chief medical officer, a hospital administrator, back in 2014. About a year into my role as a chief medical officer, I had a simple outpatient elective surgery. It was a hernia repair performed at a hospital where I used to run the anesthesia department by my most trusted surgeon. And the night after surgery, I developed massive abdominal distension and just unbearable pain. And because I was a VIP, I received alternate care. I think if I'd been just a regular citizen, I would have been asked to return to the emergency room. I would have had a CT scan, and they would have reoperated on me for what was an obvious bowel obstruction. But instead, I was managed at home for a few days until I became very distressed and dehydrated and was admitted to the hospital. About 24 hours into my hospital stay, I developed a fever. And I also noticed that my blood pressure was declining. I was tachycardic. My wife told me I was breathing 32 times a minute. And I was very familiar with sepsis because in early 2015 or late 2014, the Centers for Medicaid and Medicare here in the United States, CMS, the largest payer of healthcare insurance, made mandatory reporting of compliance with sepsis bundle elements, best practices. So I was very familiar with the early warning signs of sepsis and the early management according to the bundle. So I alerted my nurse, who brought another nurse, and they had no idea what I was talking about. Literally no idea that I had SIRS syndrome, early sepsis, and there was a specific bundle of care that I needed. So I told them to page the intern, and I instructed the intern to have blood cultures drawn, administer broad spectrum antibiotics, administer fluids. Long story short, the next day I had an exploratory laparotomy where I had dead gut, and wound up having a large operation, a bowel resection, and a long journey in the hospital that was quite complicated, but ultimately survived, and I'm here with you today. And as a brand new chief medical officer, I was very familiar with sepsis bundle requirements and early treatment. And if I had not been in my position with the knowledge base I'd attained, I think I would have succumbed in the hospital, because it was a foreign concept to my providers on the early management of sepsis. So really, the Centers for Medicare and Medicaid saved my life by introducing this bundle. So since then, I've been very interested in early recognition of sepsis at the hospitals where I have worked and trying to improve processes to improve sepsis mortality.
Thank you. Thank you. And right, I see that Doireann is now with us. Could you say a few words? Because you are the exception, I think, because you are an activist without having suffered sepsis yourself.
Thank you so much for having me. And I think it's really wonderful and laudable what you're doing today. And I'm just thrilled to be a part of it. I suppose I consider myself the least important panelist here today. And you're right in saying that I don't have personal or first-hand lived experience of sepsis, but it is something that I feel very passionate about raising awareness in relation to. And that's because through my work as a barrister here in Ireland over the last nearly 12 years, I have seen many, many families whose lives have been utterly changed and destroyed because of the loss of a loved one to sepsis. In many of those cases, they're young people, they're children. But also I've seen many cases where people have come through the sepsis and come out the other end of it, but with life-changing permanent consequences. And so this was something I saw recur time and again throughout the course of my work, representing families at inquests and during the course of litigation. And I was just amazed that while there were wonderful people from the island of Ireland who had done amazing work, like Ciarán here, our other panelists, that there wasn't any dedicated sepsis charity here in the Republic of Ireland. And so I decided, if you change nothing, nothing changes. So I decided to set about starting a charity here. And so the Irish Sepsis Foundation was born in September 2022. We launched last year during Sepsis Awareness Month, and I had actually great support in the early stages from the UK Sepsis Trust as well. So it's lovely to be on a panel with people from there too. So that's really it. As I say, I definitely consider myself the least important panelist, but hopefully I have very real experience. I think I have a lot of real experience of many, many, many stories that I have seen and that I have been absolutely touched by throughout the course of my own work. And so it's absolutely my honour to be here and to be a part of this.
Thank you, Doireann. And indeed, I think you'll make a very useful contribution, given that you very recently set up your activity. I think that's very important, and coming from somebody who's not actually a sepsis victim. Thank you very much. Now I see we've got Luis Antonio Gorordo, who's been able to join us. Can we have a few words of introduction from you, please?
Yes, thank you, Michael. Thank you, everyone, and good morning, good afternoon. I'm Luis Gorordo. I'm from Mexico City. I'm an emergency and critical care physician. And I'm the current director of Sepsis Mexico. That is like the UK Sepsis Trust or any of other organizations. This is the Mexican version of this patients and training organization. We work in public awareness in Mexico and in Latin America. And also we are doing a lot of healthcare and health professional training about sepsis for early recognition and treatment. I'm also a COVID survivor, and we found here at the hospital in 2018 the post-ICU and post-sepsis clinic that is now a post-COVID clinic also. So we deal every day with patients, with survivors and the families, doing something to make them recover from the sepsis and the diseases. So that's me.
Thank you, Luis. Right. So let's now get into a discussion on this topic of what we can do for advocacy in making sepsis more widely known. I have some questions I'm going to put to you, and if we could go around quickly and address each question. The first is, when you were starting your advocacy, how receptive did you find your national governments, healthcare, or other relevant official bodies? Did you, for example, encounter any particular resistance? Perhaps we could start, as we did before, with Ciarán.
There wasn't any welcome at any door that we went to. We had to push in every door we went to because people didn't know what sepsis was. We actually found so much resistance, or people were, how could this thing be done? That we actually made a graph ourselves, and we presented this graph to members of Congress and people in politics and state governments to show you that sepsis was killing more Americans than all the other well-known breast cancer, prostate cancer, and AIDS put together. And it was still how we didn't know that. And the hospitals didn't want anything else, because the hospitals in their books were all fine, you know. In all the countries there, they were all fine. The government were all fine. So we actually had to push in those doors, tell the story, and say, well, and in cases, my wife said to someone, well, if it was your child, would you be happy with the treatment? Or if it is your child in future, will you be happy with the treatment that my child received? And that's how we at the very beginning, but there was no door saying, come on in. There was no one saying, we've been waiting. Because as I said, on CDC's website, the American Health Thing, under the letter S, there was nothing for sepsis. So anyone that went to look for it couldn't find it. There was nothing on the internet when Rory died. So we had to start, as I said, we started the boulder at the very bottom of the hill.
And be very successful in moving it up the hill.
Sometimes it rolled back on top of us, but we just pushed it up again in some states.
Melissa, what's your take on this question?
Very similar to Ciarán's again. We've significant resistance. When William died, there was an investigation done into his death and 16 failings and 4 missed opportunities to save his life. And it was the report that gave us the foundation to push the sepsis agenda. There was a lot going on with sepsis in the UK. However, it hadn't really had the spotlight put on it. And I think there was a lot of toing and froing from the word septicemia, from bacteremia, and I think there was just a general confusion. So we had to overcome that first. But because William's story became a public inquiry, people had to get up and stand up and listen. And I think because we were given the platform with the media, the government had to stand up and listen, because if you put a grieving mother on a daytime TV show with 10 million viewers, the government has no choice but to stand up and listen. But it shouldn't be that way. And there shouldn't be other mums like me or other families that have to do that. But unfortunately, we were met with the same sort of obstacles. And now they do stand up and listen. However, we do find that all conditions are vying for the same attention and the same pot of money. So it can become very, very difficult and strained.
Yes, I can well imagine that. But certainly having in Belgium, we compete, for example, with cancer activities. So perhaps, Mary, you'd like to say a few words.
Yeah, thank you. Look, 20 years ago, sepsis wasn't even considered as an entity on its own that could be treated, really. It was just secondary of what happened versus it's completely flipped now. But really have to advocacy. If it wasn't for Sepsis Australia, which was the Australian Sepsis Network, I don't know if we would have come together. So because I knew some clinicians who were looking into my son's death years on and looking for answers, and connected me and others to Sepsis Australia, we work under them. Simon Finfer and Brett Ebenbrook are just brilliant, compassionate people that care so much about those of us who have are bereaved parents and those of us who have survived sepsis. And they really, well, we have ideas and we work together. They support us and provide feedback on what we want to do and include us in all the activities of their national strategy. So it makes advocacy much easier. And just this past June, a national clinical standard was passed, and it was because of Sepsis Australia that consumers like myself were involved in the working groups to get that national standard, clinical standard across the line. So we have a long way to go. We're looking, trying to look at a national campaign. Also, the state that I live in is incredibly forward in their approaching sepsis as well. There's a group of clinicians that are just amazing because they want to see change. So, I don't think anything would have been different 20 years ago. Sadly, we've evolved, and I feel very hopeful that things are changing.
Thank you, Mary. That sounds positive developments. Ken, was your experience similar to Ciarán's in the States?
Well, really, sepsis has had more recognition since 2015, when CMS did make this something that is part of public reporting. So there's been more awareness of sepsis. However, getting clinicians to adhere to the bundle elements is a challenge. Doctors are independent. They don't like to practice cookbook medicine, and following best practices was a challenge early on. And we still have many performance gaps. CMS has continued to change the reporting requirements or the bundle elements. And I think sepsis in the U.S. is best treated when a patient is admitted to the emergency room. I think there's, in general, better appreciation for sepsis and willingness to treat it according to accepted standards for patients in the emergency room. However, for patients who are inpatients, not as much, because the clinicians may not be as sensitized to recognize early sepsis among inpatients and may be simply unaware of best practices in the bundle. And I think complicating that, there is debate as to whether or not we've been reporting sepsis results for over 8 years. Has it really affected mortality? And there is conflicting data on whether or not the CMS bundles have really positively impacted sepsis outcomes. It definitely has increased the cost of care for sepsis patients who are now, because of suspected sepsis, getting tests, intravenous fluids, and other interventions. But as someone who survived sepsis really because of the early administration of antibiotics, which is one of the strongest parts of the bundle, is early broad-spectrum antibiotic administration, I don't think we're ready to throw the baby out with the bathwater. I think really worldwide, we should be looking at the deliberate application of elements of bundle of care that are likely to improve outcomes, and also for organizations to have skin in the game. Currently in the U.S., we have to report our outcomes with sepsis. There aren't really any penalties for non-compliance. It just is embarrassing to report publicly. And of course, mortality is one of the most important publicly reported metrics to payers, because mortality is both a measure of the ability of hospitals to provide appropriate curative care and also appropriate end-of-life care, because patients in hospice are excluded. So I wouldn't say that we have a lot of resistance from the payer side, but getting this over the goal line for universal recognition and adherence to guidelines, I think, is an ongoing challenge.
Okay, it sounds as if here in Belgium we're up against stiffer resistance. Ciarán, perhaps you'd like to, as the most recent advocate, say a few words on your experiences, whether you found it was you were pushing at open doors or more difficult.
More difficult, I would certainly say. Absolutely, the word resistance is something that resonates very much with me. And when I went about setting up the charity, which was in and of itself a very long and drawn out process going through the charities regulator here in Ireland, I knocked at so many doors. I was contacting emergency medicine doctors, ICU doctors, people from the National Sepsis Programme here in Ireland, which was set up by our health service, the HSE. And I was just absolutely getting nowhere. I was either having doors not opened or doors opened for a brief second and then closed in my face again. And so, really, if it weren't for the goodwill of the ordinary people, we wouldn't exist. We have 8 members at present, no medical member. And I have just found it absolutely impossible to get anybody from within the Irish Health Service to kind of come on board and engage with us, so far at least anyway. And I know we're in our infancy. But again, I suppose just to say that, for example, Dr. Ron Daniels was from the UK Sepsis Trust, was very helpful and, even facilitated me with a number of video calls during the initial stages, which was great because I certainly wasn't getting that from many of the clinicians here. So I suppose in Ireland, there was the very tragic death in October 2012 of Savita Halapanavar, whose death was due to sepsis, and it made headlines worldwide and kind of shone a spotlight on that. And it was in the wake of her death that the HSE here in Ireland established a sort of a sepsis program, which we don't know a lot about. And it also, for the first time, published clinical guidelines on the management of sepsis. But I suppose what I'm hearing very much from the members of the public who are engaging with us is that it's very much for themselves or for the people working within the profession, in the sense that the information isn't really available to the ordinary people. And so that would very much be my experience. Since our website went live last September, we've had, numerous contacts from people, but they're all from just ordinary people, members of the public, either wanting support and help or wanting actually to contribute and to assist us, which is great. But I don't know what the reason and the rationale for it is, when the health service and the government have been in the past so willing to budget for and fund and support other things like stroke and heart attack, which of course are huge killers. They've put a lot into road safety campaigns, etc. And yet sepsis, which is such a devastating and huge cause of loss of life, there is absolutely very little appetite for generating awareness, as far as I can see, at least, in my opinion.
Thank you. I think we just round this question off with Louis. You like to add something from Mexico?
Yes, thank you. Our experience is totally different because we don't aim general population. We focus on putting the word sepsis in the brain and in the mouth of the clinicians and the nurses and the healthcare personnel. So when most of the times we heard the same history, never this patient, these mothers, these fathers told us, no one told me what sepsis. I have never heard the word sepsis. all the time my patient was in the hospital. So we are changing the way clinicians transmit the information. We are putting the word in their brains, in their mouths, and spreading from the healthcare professionals to the general public, to the patients, to the relatives. This is not just an infection. Your patient is not with pneumonia. Your patient is with pneumonia plus sepsis. So that's the way we are doing the public awareness. And then when we train, we are doing these survivors groups from those clinicians that are being training. And we are doing sepsis code, what we call the sepsis code program, in hospital by hospital. And we're training not just the emergency physicians or personnel, as just Ken told us. We are doing the same with surgeons, with obstetricians, with internal medicine, with medical students. And we're pushing forward with the new generations of doctors and nurses all around the country to train them of what sepsis code and sepsis is, so they can promote with the patients and the families. Now we have the national guidelines for maternal sepsis. Is about 2 years ago it was published, and for the pediatric sepsis also, and for the geriatric population also. So now we have trained enough people that is taking decisions to make these national guidelines, but they were trained by our group.
Thank you. In the meantime, we've had a couple of questions coming up from the audience, and I'd just like to address one. There's one that's from Imra Malik, which actually is aimed to Ciarán. I don't know whether, Ciarán, you've seen this question, but she asked in particular whether you could share more details about the toolkit items and how to get legislators really to hear us. Now that links in a little bit with what we've just discussed, but and I'd link it up also to a question that I had, was in your advocacy action, what steps had the most impact, and what was the let's say, what were the obstacles that you really had to overcome? Ciarán, would you like to just tackle that question that's come in?
Sure. I'm sorry, I was muted there, as people will be happy. As what are the most impact? And I think Mary and Melissa have walked this one with me, is when you tell the last 3 days of your child's life continuously and continuously and over at all events, and the last 2 days and the last day, and the doctors coming in shaking their heads, sorry, we couldn't save him or her. When you do that time and time again, it has an impact, and people will listen to it. And we did that, and we went from that to New York Times cover a story, the most publicized one ever, on Rory's death. And then Governor Cuomo signed Rory's regulations into law to say there's a standard we expect for our citizens in every hospital that's licensed in New York State. That has saved 16,000 lives in 4 years. And getting a governor and a health commissioner to come down and say, here's what we're doing. And there was those, again, as I said, that said, we don't need those, we don't need regulations, everything is fine. Those were silenced by the governor and the health commissioner and others who said, it's not good enough. And it wasn't good enough for Preston, it wasn't good enough for William, it wasn't good enough for Rory. And to take that, we have the template. And I think what the question was, going into other states, we have gone to many states to try and say, well, here is what, and this is what makes it very difficult, is you say, we have a template that is saving lives. Oh, by the way, and saving a lot of money in the hospitals. also. So you've got to double, and there's still a hold on. So what we did this year is that we moved to the federal government and said, it is time for you to impose this. And it's coming up later on. I don't want to take up everyone else's time, but it is time for the federal government to step in. And we've had successes with that, but we have met the children that Rory's regulations have saved. And we've had the communications from other states who have bought the coffins, like Mary and Melissa and myself have bought. Unnecessary.
Thank you. Going along Ken, you're also in the States. Do you have anything to add to on the question of what steps in advocacy have had the most impact?
Certainly survivors groups are very helpful in having a voice. And I think it's time for hospitals to realize that, in fact, sepsis is really the #1 service line at most hospitals. It's the highest number of discharges with that diagnosis. So there's no way to overemphasize or oversupport sepsis recognition and appropriate management. I think the future, though, is to get a lot of sepsis management out of the hands of humans and to use more advanced early warning tools. And so far, early warning tools, either algorithms and such that run automatically in electronic medical records, have really failed to fulfill a promise for bringing sepsis awareness to where it ought to be. But it's a continuing journey.
Thank you. Continuing around the table, so to speak, although we don't have a table. In the case of moving on perhaps to Ireland, Doireann, as the most recent activist, if I can put it that way, what steps have you found had the most impact in your action?
Well, we are very fortunate in the Irish Sepsis Foundation to have on our board Joe and Ciarán, whose son Sean, who was an up-and-coming rapper, died aged just 15 back a number of years ago. And they actually, they're involved with the charity now, but even before that, they had their own awareness campaign in his memory called Little Red's Legacy. And one of the things that we did just after we set up last September was we decided to run a radio ad. And we managed to negotiate a very good deal with our national radio broadcaster here in Ireland. And we had a very, very short 40 seconds to go into a studio and record, a punchy short ad, which ran throughout the month of December in the lead up to Christmas. And it was about making people aware. And essentially, during those 40 seconds, Joe and Ciarán spoke at the beginning about losing Sean to sepsis and not knowing what sepsis was when he died. Very like the three here on this panel, I'm sure, with their awful experiences to share. And I think that was one of the things that was one of our very first projects, but it was very powerful and very effective because it had such a mass reach, and it was something that we as a group felt that, again, the health service or the government here in Ireland could have done and should have done easily in the past and never did. And it was something that we put an effort into, and we think it was successful. So hopefully we will run further things like this, but that certainly was one of the things that we found good. But I mean, I think I would agree with the others when they say, I can't imagine what it's like to have to continually tell and repeat your story of loss and grief and all that comes with that. But I do think that it is just so effective and so powerful, and that is what really gets to people's hearts. And I think that is these are the really striking stories that resonate with people and that affect people on a deeper level. And I would just like to say to the three of those as well here on the panel that, they could and they should be so immensely proud, because they've no doubt that countless other parents have had the lives of their children spared because of their bravery. So while it is so difficult, I think it's really, really very commendable what they're doing, to just keep speaking about the story, because that's it. It's sharing, sharing that message is saving lives.
Thank you, Melissa. You're in a position where you are one with the most developed, or one of the most developed actions, the UK's Sepsis Trust. What have you found to be the most steps or actions that had the most impact? And we know that in the UK you had this tremendous sort of advertising campaign, as I recall. Was that the most effective, or have there been other actions that you found very, very effective?
I think that, so following William's death, there was a guideline brought in by NHS England for all healthcare professionals to follow, that was mandated. So that's for community care, hospital care, and that was a toolkit, a help guide to help diagnose sepsis, and then obviously the Sepsis 6, which is widely used across the world. We already had that was in place, but our biggest issue was actually getting the people at home to know about sepsis and then get to the healthcare that they desperately needed. So it's about public awareness, and it was about getting the public to not just know the word sepsis, but be able to look at their loved ones and think that could be sepsis, to understand it, and then approach healthcare and say, could this be sepsis, and have a conversation. Following William's death, we had an enormous amount of media coverage, and that really played into our hands. And following that, there was a huge campaign. Over 1.1 million healthcare professionals were contacted and made aware. And we also I happened to do a viral video, which was a bit unorganized and overnight, and just I was heavily pregnant at the time, and did a viral video, and overnight it had 42 million views. And I couldn't have anticipated just the reach that would have. And sometimes it's like Doireann said, and like Ciarán said, it's the human voice. People don't want to look at the TV and think that could be me, because it was me, and it was Ciarán, and it was Mary. And that there's nothing more powerful than that. And I think, going out and telling your story at conferences and talks and whatever it might be, there's an emotional hangover that comes with that. But I find that this is my way of parenting William now somehow, because that's been taken from me. So we've got nothing left to lose. So we push every button, we open every door, we push every boulder up every hill, and when we keep getting trampled on, we trample back. And I think that's it. It's tenacity, it's passion. And when you stand up enough, support in numbers, create a wave, create a tidal wave. And I think that's really important, is the voice of the person, the voice of the people.
Thank you. I think I'll have to come back to you with my Sepsibel group on your viral video experience, because we're still at a very early stage, and every tip, if I can put it that way, or any successful effort is certainly, we can use it in Belgium, because in Belgium we are very much at base. We've got a long way to go before we catch up with many of you. Mary, would you like to add anything on what particular steps in your advocacy had the most impact?
Yeah, sure. I mean, in Australia, we're in a big country with a relatively small population, and so quite disparate. But I think like Melissa and Ciarán, we use a photo of my son as, this child could be any child. I mean, he could be anybody's child, right? And he's more the symbol, because it is so hard to keep telling his story. I kind of look at him as just the poster boy now, but it is about people's stories. Again, Sepsis Australia, brings up consumers together, although every consumer also have their own way of advocating, have either started their own charities. A young boy named Thomas died when he was 13 in the Northern Territory, where there's a highly indigenous population who is also, our First Nations people are the most vulnerable to sepsis, and they do a lot of targeted communication, but they come to us as a consumer group under Sepsis Australia, and we share this stuff, we talk about it, we spread the work that everyone else is doing. I think another a powerful medium has been social media. One of our sepsis survivors has started just a support Facebook page. Well, there's hundreds and hundreds of users now, and now we have some really supportive clinician groups who are using that to survey and find out more. And I mean, Sepsis Australia, well, we individually as consumers will knock on doors in our states, the politicians, and try to get sepsis sort of front of mind, because every time I see a report comes out that says, in this state, cancer or heart or whatever are the leading causes of death, that sepsis is never mentioned, I just want to go crazy. And so we advocate for change and awareness. But what we're looking to now with Sepsis Australia is getting a national campaign. And again, we've got a really good consumer group that's quite networked, and it's the guidance and leadership, I think, of a group like a UK Trust or a Sepsis Australia is imperative, because while we all go and do our own door knocking or to do it together, bringing us together and sort of shared goals and then sharing each other's work has just been it's been critical in a country like Australia, where we're so far spread out.
That, I guess, is also something in being spread out in the United States. I don't know whether, Ken, you have any reflections on getting the message across a very wide public.
Well, you'd think we would have made more progress than we have really made since CMS reporting became mandatory here in the States. And as I said earlier, I think the biggest challenge is to get to all providers. Emergency room physicians are pretty well attuned to treating sepsis, but in other situations not. And I do a fair amount of peer review for other organizations, and I've recently just seen some terribly sad stories of patients with missed sepsis or delayed treatment, which could have easily prevented a fatality. So, getting the word out throughout all organizations at every level is incredibly important. Most larger hospitals have a position called a sepsis coordinator, who works with the clinicians to ensure that the appropriate care is being delivered. They also abstract all the data to create reports to not only the government, but also then providing feedback to providers. And we've been doing this for a period of years now, and I think we've made some progress, but there is really quite a long way to go. And certainly when you get into more austere environments, rural hospitals, critical access hospitals, they simply do not have the resources that we have in the larger cities.
Thank you. I just might like to switch over to Luis, who's in a somewhat different situation in Mexico, as I understand it. But what do you think is the most impactful actions that you have been able to take or think about taking in Mexico?
Yes. I think that we have two major or most impactful steps in the public awareness. One is, as you have already said, is the public and the media coverage of the maybe some cases, some survivors or some tragic deaths of some patients. But also we have reached institutions here in Mexico. The public and the private healthcare systems are really, really different, and we try to reach them with numbers, with data. So we are doing research about the impact of the sepsis early treatment recognition and in the money, in the budgets of the public institution or the private institutions. And that's something that is very, very impactful for everyone. They don't care if they're working in a public institution, at a government institution, and a private institution. When they say numbers, when they say we are saving lives and money, they really turn into what the sepsis code program is. And that one, I think, is one of the most impactful tools we have now to reach everyone and everywhere.
Yeah, questions come in, which I think I can put to as a general question. It's about the position of in the protocols that may exist for handling the packages or bundles. To what extent is anything included of listening in your country to what, let's say, what's termed worried signs from relatives, parents? To what extent is that? See, I know of two cases, looking in my own case. In my case, when I had septic shock, the young medics were completely lost. And my wife was saying, look, I think my husband is seriously ill now. What are you going to do about it? And the answer was, well, they sort of hung around and waited. And recently, we had a case in the news here where a lady, her mother, I think it was admitted to hospital with signs of serious ill health. And the hospital said, this is nothing too serious, and here's some medicine and go home. And she refused to leave the hospital. She insisted upon staying, and sure enough, she had sepsis. And luckily, by insisting upon staying in the hospital, she got the treatment that was needed, only just. And the question, therefore, is, to what extent do protocols flag that you should listen to the people, the family, the relatives or others who say, look, this person is ill? What's your experience in your countries? You just go around quickly upon this one. Lewis, since you're on the screen, you could start.
Thank you. Yes, empowering patients and relatives is very, very important for general sepsis awareness. I think it should be both ways. We have some promotional videos. We have in the GSA and the World Sepsis Day website, we have the What is Sepsis video in several languages, and the infographics and the pocket cards that are aimed to the general public, to the lay population. So yes, I think empowering everyone about what a sepsis is and the early signs is really, really important. As in a stroke or a heart attack or epileptic crisis or whatever disease you are treating and you're aiming, you have to empower the patient about the alarm data, alarm signs and symptoms, so they can push the clinicians to look for them, for those signs and symptoms in the early way. But if you don't have the healthcare professional training on this early recognition, it wouldn't work if you have a lot of public awareness and a lack of healthcare professional awareness about sepsis. You need a balance among those two knowledge in the general population and the healthcare professionals.
Thank you, Luke. Ken or Ciarán, what's your position on this in the States as to whether any protocols really sort of highlight that you should listen to the family and the relatives when they're saying, look, something's wrong?
Well, you raise a good point. And the science shows that when a physician meets a patient for the first time and says, "What brings you in here today?" they interrupt the patient in about 12 seconds. And good physicians know that if you simply sit on your hands and remain silent, that if you let the patient talk, eventually they will tell you the diagnosis. And I think many organizations have placed an emphasis on patient and family involvement and recognize that shared decision making really requires the input of patients and family members. I always feel very worried for elderly patients who come to the hospital without someone to advocate for them. And the role of family and advocates cannot be underplayed. I also will echo what Louise said. We don't have general awareness of sepsis outside of healthcare facilities, even though there have been many campaigns for awareness of symptoms of stroke, the acronym FAST, awareness of early heart attack treatment, and even doing CPR. There's CPR training, kiosks in airports and whatnot. The same thing does not exist at all for sepsis. And I think better appreciation of what is the biggest killer of hospitalized patients is sorely needed.
Thank you. Melissa, could we turn to the UK? Because there I think you've been pretty successful in spreading the awareness outside the medical and healthcare professionals to the general public. I have one of my brother-in-laws in the UK, and he's managed to get sepsis twice. But each time it was picked up straight away. He was aware that perhaps something was wrong, and the hospital took immediate action. So instead of being a serious case, he was back home in record time.
That's great to hear. That's exactly what we want to hear. You're exactly right. I think 50% of treating the patient is treating the family. There is no one better to understand the subtle changes and subtle signs of the patient than their loved one. And certainly with those with children like mine who was nonverbal, I am his voice and his ears. We have a system in the UK called the National Early Warning Score, and it is a list of parameters where they look at the symptomology of the patient and they mark them according to how far away from normal they are, so to speak. And one of the parameters on there is the concern of a loved one, and it's certainly used on the pediatric early warning score, parental concern. And whilst there are some hospitals that like to deviate sometimes, by and large, 90% of the early warning scores in all hospitals in the UK will have a parental concern or a loved one, a carer concern. And I think that's really important because as Ken pointed out, they will generally tell you exactly what's wrong with them within a few minutes. So, and again, like you say, it's awareness of the public. If you can get the public to you and they can say to you, I think I have sepsis, and you use that word, the physician is then able to say it is sepsis, or I suspect it's sepsis because of, or it isn't sepsis because of. That's reassurance, not false reassurance. And with that, you can build on something.
Okay. And Mary, in Australia on...
Yeah, similar bit to, what Melissa was saying. We're not that far down the track. But when my son was dying, I remember saying, I think he has leukemia. And they said to me, why? And I said, that was the only thing I could think of that would explain how sick he is. Now, that probably should have triggered them to look deeper, but it didn't. So we talk about educating the public, and we do a lot of public awareness using the term, could it be sepsis, to trigger then a clinician to look for it. It almost obliges them to look for it. When you ask, could it be, and they've got to rule it in or out. But we don't have a national awareness campaign. The clinical standard, when we talk about listening and working with the parent or the family, the clinical standard is a quality statement that you need to work with the family, and if the family is raising concerns, you need to look deeper. Their pathways have been introduced both in emergency departments and in in ward here in Queensland, in the state I live in, which again talks about, or expects that the family plays a role in educating the clinician on this is not normal. My child is very, very ill. You need to look deeper. But could it be sepsis is the phrase we're trying to get across here in Australia. We're doing the Department of Health here in Queensland do a lot of campaigns, but it's quite internal. But I think using that word sepsis, asking if it could be sepsis, and educating the public to ask that is critical, because that will trigger, or that should trigger, someone to look for that and either rule it in or out.
Thank you. I'd like to sort of broaden the discussion slightly really try and answer the question. There are a lot of countries where not much has been done yet to tackle sepsis, at least publicly, for either lack of resources or whatever. In some cases, they may be European countries where you'd think they'd be more advanced in addressing sepsis. But what sort of advice do you think one could give to people in countries where not much has been done yet, but there are people who have suffered sepsis? What advice would you give to anybody who was wanting to start an advocacy action, a patient association or something similar? From your experience, what sort of things would you say, this is the way to tackle it? Perhaps we could start with Ciarán again.
Well, I think, Michael, we've talked about the hard elements here, and I forget sometimes that we have an audience other than ourselves. When I gave the Global Alliance in Germany last year, we had 172 countries watching in. And sometimes we forget we've had successes in the United States. So I think we encourage them is that they've got to stay with that boulder we talked about, because we started with the boulder. And if you look at today, our successes, not just in New York State, but CMS, as someone said, have done a fantastic job on national programs. CMS credited the meetings with us, with implementing a national policy in place. It took us a long time to get that meeting. CDC were very tough at first to get to, but Tom Frieden, the head of it, said, I want to thank the Stauntons for persistently going at us. And we kicked down the doors. But I would encourage the people not to just say, well, we didn't get the meeting with A, we didn't get the meeting with B, because, success has many fathers, failures an orphan, right? And I just think that any of those countries, to look at what's gone out there, start at local government, start at local policy, and even in building an organization, you start with your relations, you start with your community, and you start with your local paper. And then you go on to your polls, because just remember that this year, we have got it in the United States federal budget. Federal government, a multi-zillion dollar budget, has money and wording for sepsis. That didn't happen overnight. And this year, we got the 100 senators to agree on National Sepsis Day. 50 Democrats, 50 Republicans came together, 100 of them, and voted aye in favor of it. So I think to those many thousand watching us today in other countries it takes, I don't want to quote some political person, but it does take more than a village. It takes a lot of people in here, but anyone here and any of the countries who have successfully done that and saved lives says, listen, go for it. It can be done. And it came at a high price to all of us. All of my wife, she was here, would say the same thing. And I'm sure Mary and Melissa would say the same thing to us. Go for it. Get out there. There's no difference. We would expect the European socialist countries with socialist healthcare to grab this and run with it. They haven't. We have led the way in many cases. So I say to those countries out there, those people, get it up, get going, and go for it. You can do it.
Thank you. Doireann, perhaps you'd like to give us a viewpoint as you're the youngest association.
Yeah, well, I agree with everything that has been said. And I suppose the message really I'm hearing is to just go for it, and that there's no time like the present. And I suppose just in terms of our own foundation, I suppose there was a little bit of negative feedback at times in terms of things like, oh, well, you know, is a lot of this about scaremongering, and, you know, you're creating a lot of unnecessary hysteria and hype amongst members of the public. And that sort of thing, you know, at times maybe got me down and some of the others, but I suppose it's just drowning out the negativity and focusing on the positive. And I mean, the message is that the more early awareness, diagnosis and treatment we have, the more lives we'll save and the more better outcomes we will have generally. And so, like, as lay people, we can't do much about diagnosis and treatment, but we can about the awareness. And so the focus is very much on that. And I think that we're absolutely right and correct to be focusing our attention on that. And I suppose I'm very lucky as well to have, as part of the foundation, the Corcoran family too. And you know, we're talking a lot here, I suppose, about parents who've lost children, and they're, I suppose, the reverse of that, because the Corcoran family, they lost Tracy, who was 37, and she left behind her, when she died 2 years ago, her 2 children, Sophie and William, who are now kind of coming into their teens, and they're growing up without a mother. So, like, it's devastating whatever way it happens, parent losing a child or child losing a parent. But Tracy's sister, Sinead, is and brother James and wife Lorraine are members. And like, what sticks out with me is Tracy's sister saying to me, Doireann, you know, nothing's going to bring Tracy back. But she said, I want to do whatever I can to help and to prevent another family having to go through this. She said, I would literally sit down and lick stamps all day, 7 days a week, if I thought it was going to, you know, prevent other people losing their sister to sepsis. And I just thought that was just so really moving. And so that's all I'd say is we've had a really positive experience since we started the foundation. And so many people in Ireland have contacted us and said they've had their own experience, they've had their own loss, and they just want to help and they just want to be involved, and we're creating a really lovely sense of community. So I would encourage anyone, wherever they are, to don't dwell on it, just do it.
Thank you. Melissa, perhaps you could give us a view from, let's say, one of the most advanced countries in this respect. What advice do you think your sepsis trust would give to somebody in a country starting up an action?
I echo everyone else's thoughts. I think every voice and every person matters, and to never stop, because no matter, you don't need to have a really, really big platform to make an impact. And as they say, every footprint leaves, you know, a memory on this earth. And you've got to start somewhere, and you grow and you grow. And we have a community. We have a community on social media. We have volunteers. We have those that have survived or are bereaved, and they are part of social media groups. They are part of face-to-face groups. They support each other, and they grow, and they share their stories, and they're listened to and they're heard, and that makes them feel empowered, I think. And so I would just really, really encourage people to not stop, keep going, keep putting one foot in front of the other. And if, you know, sometimes you do have to take a break, you have to stop and sit down and take a breather, because it can be mentally exhausting doing what we do. But just know that, you know, out of darkness comes hope, and we all live with hope. And so just keep on going.
Thank you. Well, I think we're going to have to start wrapping up this session. I thank you all for your contributions, a useful discussion. Whether we could bring out some points when looking about what family can do to how do we say, have effective advocacy, and the actions that have been taken. There's some of the things I've listening to what's been said. I mean, one of the things comes through that we should encourage people to hammer on doors, don't take no for an answer. another thing that seems to come out from many of comments is that one should really use as much as possible the media. Don't keep quiet, make it public. You know, you've got, I think, if you can get a spot on television, for example, or you can get something which really penetrates households and makes people aware. And would people agree with that as actions that one should really be looking at from the point of view of survivors and family members to shake things up? Any thoughts on this?
Yeah, I'll chime in, Michael, and I don't make it a habit to quote Joseph Stalin, but he said something that is very profound, that the death of one person is a tragedy. The death of 1 million people is a statistic. And I think for the other members of the panel who've been very successful, they have started with a story of a loved one that they have lost and have carried on in their memory. But that, I think, is the most important way to move forward, is with stories, not statistics.
Okay.
Can I add something as well?
Yes, please.
You know,
Yes.
If I'd had the power of social media when we were raising funds for the pediatric intensive care, I would have tripled that amount. And social media is incredibly powerful. And for those who don't know where to start, it's about the stories, and it's about collecting other stories as well. And through a group, then you can also identify some leadership, which is really important as well. And I think that's a great place to start, is just harnessing that social channel to gather stories and momentum.
Well, thank you. I think it's time to thank you all for your contributions and for this discussion. I see that we're coming to the end, and I believe I've just seen a note here from Marvin that there's going to be a session later, a media session, session 15. So this is a bit of an introduction, if you like, to that. So thank you all for your contributions to the discussion. I hope it will have penetrated well, because I see that we've had I think 1,000 people have been switched into this. So we've had a good audience. I think it's also perhaps time to thank the organizers for their setting up this session, setting it up again. And I hope now that we can also thank the various sponsors for supporting this whole event and this session in particular. I'm happy to say that I've seen that one or two of the sponsors have a presence in my home country, Belgium, so I shall be know whose doors to knock on in the coming weeks. So I get all sorts of messages coming up here, but I think now we should be closing off. Unless anybody wants to add something before we run out of time.
I think it's important to thank the organisers, Imrana, Tex, Dr. Daniels, Marvin and yourself. And I think for us here today as parents, Preston, William and Rory, to remember that we must keep this going. And that's what we all commit to. There's no turning back. Thank you to all the organisers.
Indeed. Thank you to the organisers and the sponsors. I believe we're going to get a list of the sponsors coming up shortly. We've got the gold sponsors, silver sponsors, and is it bronze sponsors who've made this whole thing possible.
Fair play to them. Well done.
Well, thank you all. And goodbye, everybody.